I think that self-awareness is really important, and also people are uncomfortable when they feel like they have to be taken out of their natural environment.
Yeah.
But sometimes that is the kick in the butt that you need to reset things. When you take yourself out of your natural environment, also the bad habits, they sort of get a break. The types of people that maybe you were hanging out with that maybe were bad influences, you're not around them anymore. And oftentimes, especially when there's a co-occurring substance abuse issue, I find that that can be really helpful.
There's a lot of treatment options. You can go one-on-one therapy, group therapy, treatment centers. How do you navigate that?
Well, I always like to think about it in terms of level of support. So how much support do you need at this time? Sometimes people really need a lot of support, around the clock support. And that's when they might go to residential treatment centers. This is sort of, you go and live in a whole different place and the treatment comes to you.
Wow.
All the providers actually come to the house or the facility that you're living in. And it includes a number of different things. It includes psychiatry. It includes individual therapy multiple times a week. It includes group therapy of different kinds multiple times a day. And sometimes family therapy as well, if people are needing sort of that support from that angle. And most of the times they do, because the family is going to be helping this individual when they come out. There might be hurts and pains that they need to deal with, and it's a great safe place to do that. That's really the highest level of support, is sort of that round-the-clock care. There is technically one even higher than that, which of course is hospitalization. This would be that you're in a medical hospital because something needs to be stabilized before you can even be transferred to a residential treatment facility where you don't have a medical staff there 24/7. You have your providers coming in, but at night you go to sleep and it's just regular staff who may not be professionals. And so that's part of the issue, is understanding when you might need that, because it does mean that you have to leave your surroundings. You might have to tell your job you're taking a leave. You do have to arrange things for that to happen. And usually residential treatment centers will go on for anywhere from 30 days to maybe 90 days is very typical. After that, there is sort of a lower level of support called partial hospitalization. It sounds scary, but what it is that you're basically going to treatment like a job. So you go 5 days a week, 7 to 8 hours each day. And again, you get psychiatry, you get individual therapy, and you get various group counseling sessions. Intensive outpatient programs are the next level down. This is when you need a little bit more support than just seeing your counselor maybe once a week or once every 2 weeks. But it's not so much that you can't also continue to have your life, living at home. You're probably going to work, because most intensive outpatient programs happen in the evenings. So they'll happen 2 to 3 days of the week for about 2 to 3 hours each time. And usually you get a combination again of individual therapy and group therapy during that time. And then the lightest level of support, of course, is just regular outpatient therapy, where you go see your counselor maybe once a week, and maybe you see your psychiatrist once a month or once every 2 months, and you're managing everything else and you're feeling pretty good about it.
That was a perfect breakdown. And in terms of people deciding what they should go to, or helping a loved one decide which one they should go to, is it kind of just whatever they feel like they need?
Well, I think it's always good to think about starting at the least restrictive level of care.
Okay.
So can you be managed just doing a counseling session once a week? And if you're not getting the results that you want and you're feeling like you're still having problems, maybe step it up to the next level.
Or see a different therapist.
Or see a different therapist. Try that first.
Okay.
And then try a different medication, try a different therapist. If that's not working and you feel like you just need more support, maybe more intense therapy, go to an intensive outpatient program. Most cities and towns do have them somewhat nearby that can be workable, and a lot of them are dual diagnosis serving. So they deal specifically with individuals with both depression and anxiety, and also substance abuse components. If that still doesn't work, then you move up and you move up and so on. I think the only exception would be that the person's life has spiraled out of control. Perhaps they were even just hospitalized because of the withdrawal symptoms they had from alcohol. Maybe they even had delirium tremens. Well, at that point, you really should go straight from there to a residential treatment facility once you're medically stabilized, because you clearly need to have a lot more support during that time to make sure that you stay on track. And then from there, you can move on slowly down the ladder.
It's really important that people are honest with themselves on what they need.
Yes.
I can see even myself going, oh, well, I don't need that. I can handle this over here. When really I know I should probably take option B or C instead of A.
Absolutely. And I think that self-awareness is really important. And also people are uncomfortable when they feel like they have to be taken out of their natural environment.
Yeah.
But sometimes that is the kick in the butt that you need to reset things. You need a reset. And when you take yourself out of your natural environment, also the bad habits, they sort of get a break. The types of people that maybe you were hanging out with that maybe were bad influences, you're not around them anymore. And oftentimes, especially when there's a co-occurring substance abuse issue, I find that that can be really helpful.
What are some realistic expectations for improvement when someone first starts whatever treatment plan they've gone with?
I think a realistic expectation is that you start to feel a little less hopeless. It doesn't mean that all your problems are solved, but what I hear most from clients who maybe finally took that step is once they're integrated into that community, whether it's seeing their provider consistently or they're part of an intensive outpatient program or residential program, is that they feel like maybe there is a way out of this after all. And I think that that is the kind of support that professionals can give you and the kind of encouragement that they can give you when they start to give you insight and techniques that can help manage your issues. A lot of times people find that the hopelessness is really what keeps them from getting better. Because if you believe that nothing's going to change, why would you do anything about it? And I think that's part of the issue with a lot of individuals who are reluctant to go to therapy in the first place.
What about parents of children who are in therapy and those kids are coming home after a session or after being in a treatment center and saying, oh, it's dumb, I hated it, it was stupid, I didn't learn anything? How do we know if it's working or not, if that's the feedback?
Well, I think as a parent, you definitely need to be talking to your therapist regularly.
Yes.
If your child is under the age of 18, you actually have full access to their records. And you should use that access. Mm-hmm. You should be asking the therapist questions. You should actually be asking for alone time with a therapist. Oftentimes, I encourage parents of my clients to come in 15 minutes before the session's over so that I can spend the last 15 minutes with them. And it's important. You got to keep them on top of it. You got to make sure that they have a forum to ask questions of you. And also because they are supporting the child, you need to give them some insight into what you've been working on so that they can try to replicate and reinforce that at home.
For an initial therapy session, or actually at any point during therapy, can a loved one be in the session with the patient?
I think when a person is an adult, that is up to them. So the client will say, you know what, I think it would be really nice to have my mom in here for this one or my husband in here for this one. And sometimes the therapist can also gently suggest it, but that's ultimately up to the client to decide. When the client is a minor, absolutely. I think that that should be a part of the therapeutic process. I think that they should be involved to some degree. And obviously the older the client gets, maybe the less involvement there is to sort of match that developmental trajectory. But I think that they should always be involved because again, that person is living under their roof and they need to work out any conflicts that are possibly causing some of these emotional symptoms.
When does treatment fail?
I think it can fail in a couple of different ways. I think one could be that the client is not really that motivated to...
Okay, but what 16-year-old is motivated to not go out and party with his friends? That's what they want to do.
Right, no, it's a good question. And I think that a lot of clients who are minors, their motivation comes from a different place. You know, it's not so much, well, I want to go out with my friends instead of being at therapy, and that means that they're not motivated. But it means that are they spending time developing a positive relationship with this therapist? And do they care about that positive relationship? That could be an area in which people do falter. And I think when that happens, then the kids are just going through the motions and therapy is failing because they don't feel particularly connected to this therapist. They don't necessarily care about what the therapist has to say. And if that type of dynamic exists, then treatment probably is failing. I think that it's also failing when you are not seeing any improvements in your life. And yet you stick with it and you're like, I'm going to therapy. Well, but if it's not working, why are you still doing it? Go to another therapist, find out another technique, try something different. And a lot of times people will say, well, I've been going to a therapist for 5 years, but it's not working. And I ask them, what do you mean by that? What do you mean by it's not working? Are your emotional symptoms not improving? Is your life not getting better? Are your relationships not improving? If all of their answers are no, then it isn't working. But sometimes they say it's not working. And then when I ask them those specific questions, they're like, well, yeah, my mood is better. It's just not perfect. I'm like, okay, but that means it's working. Unless you hit a stalemate unless you improve for a bit and now you're not making any improvement at all. And at that point, it is a time to discover whether or not this therapist is still right for you, or maybe it's time to try it on your own. Maybe you've gotten the improvement you need from therapy. You don't need your handheld anymore. And in fact, I love it when my clients graduate therapy. I don't want to have them be in therapy for the rest of their lives. I would hope that they leave, and feel better.
What qualities do you see in patients who have depression and substance abuse that overcome it?
I think the people that tend to overcome it when they have the co-occurring issues are people who feel like the control rests within them to change their lives. I think when they feel like outside factors are the reasons for why they have depression, or outside factors are the reasons why they drink, it takes a longer time for them to get to a place where they feel better. I think once you start taking responsibility that these are my decisions and these are things that I can do, it makes the therapeutic process so much faster, because then they're also more likely to take in your advice and try your techniques because they actually feel like they have control of the situation. So I sometimes find that people will blame other people for their problems. Well, it's because my parents treated me badly, and because my boss is terrible. But that type of stuff can really perpetuate the cycle of helplessness. Like, if the person is at the whim of everybody around them,
it's not a life.
Yeah. And then you always just feel like you're kind of floating around with no anchor. And that really messes with somebody when they're trying to get treatment and trying to start taking more responsibility for what they can do.
In our first episode, you said stress is normal. Stress happens.
Yes.
We act like we're not supposed to be stressed.
Yes.
And when you said that, I go, that is so right. I'm gonna take that away for me.
Yes.
Because we act like, oh, well, if we have stress, we're doing something wrong. Something's bad. We screwed up. Blah, blah.
Right.
No, it's just because we're alive. That's what happens.
That's exactly.
And it just reminds me of, you're going to have bad bosses.
Yeah.
You're going to have bad things happen in your life. It is up to us to handle those things correctly.
Absolutely. And I think that is exactly what, people should remember, that emotions, positive and negative, are just part of the human experience. If you don't have any negative emotions, how do you know when you're having a positive emotion?
Yeah.
Like, you really don't.
And who are you?
I know. And also, who are you? You're not really.
Gross.
You're not a real person.
Get away from me.
You are not a real person. Yeah. And I think, people become so frightened of negative emotions. Like, they have to push it away. They have to avoid it. They have to escape it. But why? Why? Because the more you struggle with it, the more you're going to have that emotion again. And by the way, anything that's meaningful to pursue in life is going to be wrought with some negative emotions, whether it's stress or worries. I mean, think about anything like moving to a new place, starting a new job, starting a new relationship, getting married, having kids. They're all very meaningful things to do, and yet there's ups and downs.
Yep.
That's life. And if you're actually pursuing the values that are most important to you, you're going to have negative feelings. So it's okay to have them.
Final thoughts on treatment. What do you wish every single person who came in to see you for depression and substance abuse knew?
That there's many ways to skin a cat. So you don't have to worry if 1 or 2 or even 3 treatments didn't work for you. There's so many other ones. And you are a unique individual with your own personality traits, your own tendencies, your own reasons for why depression and substance abuse became a problem for you in the first place. Why do you expect that there's a one-size-fits-all treatment? People sometimes take treatment once. They say, well, I went to one rehab center. It didn't work for me, so I'm just going to be an alcoholic for the rest of my life. Nope. That's absolutely not the case. You maybe did not find the best treatment center for you. Yes, there's bad treatment centers out there, but there are perfectly good ones that just weren't a match for you. And you have to keep trying. You have to keep trying different methods, different people, and you will find the one that works for you. So don't give up. There's so many different ways to get good treatment now.
You guys better time code that and save that video when you need a little boost from Dr. Ho. And you wake up and go, I don't know about today. She's going to go, don't give up. There are other treatment options.
Don't give up.
I love that. As I tend to do towards the end of each series, I like to open it up to our camera crew, our producers, to see if they have any questions for you on this topic, of course. So if they do, speak now, and if not, I'll probably email her for you. But I'd rather you ask me now if you have any. Do we have any over here?
Something, let's say I'm the loved one, or I'm the supporter of a recovering alcoholic, addict, what are some things I can do to make it easier day to day?
Wow, that's a great question.
Let me just say it one more time in case they couldn't hear her. She asked, as somebody who is a supporter of a recovering addict, what are some things I can do to help them day to day?
That is a great question. And I think actually the first thing is, it's not your job to do their recovery for them.
Isn't that such a great thing to hear?
I think people do get into that sort of codependency that happens a lot with addicts and their loved ones. And you want to take control. You want to make sure they're going to be okay. But no, that's actually terrible. You have to let them pursue recovery on their own and be there as the backdrop, be there as the foundation, as the structure. But you are not doing that work for them. So on a day-to-day basis, you check in with them. You ask them how their day is going. You ask them how their therapy sessions went, how AA groups went. Just check in to make sure, again, sort of that monitoring piece, you know, what's going on? How's everything going? And when they're having a bad day, it's not your job to pull them out of it. So it's not your job to go rescue them. You ask them how you can support them, but if they're just having a bad day, you don't have to have a bad day along with them. You just say, okay, well, it seems like you're dealing with some stuff. I'm just gonna be in my room. You know, if you need me, I'll be there. Just let me know how I can help you. Be the supporter in a very empathic and non-directive way. But when they start to do behaviors that fall back into addiction, you do have to maintain that structure. You can't hide for them. You can't call in work sick for them. You can't, you know, somehow, because they ran out of money this month because they actually ended up drinking again and bought alcohol with it, give them money and
That's
loan it to them.
enabling, that's not supporting.
You can't do that. At that point, you say, well, clearly you've fallen into some of your previous behaviors. What can we do to get you back on track? You want me to come with you to therapy? You want me to go with you to AA today? What should we do?
Yep.
Right? Problem solve everything as it comes up, but you are not the first person to come up with a solution yourself, and you're not the person to enforce that on a day-to-day basis.
Did you get it?
So good.
Good.
Follow-up question. So then,
Yes.
let's say they run out of money, they spent it, whatever. So then, how do they eat that month? What's your suggestion? How do you figure out this way that they can still stay alive, but you don't give them anything? You know
Right.
what I mean?
Ugh.
Like, do you tell them to go to the food bank? Do you?
Can I try to answer that first?
Yes.
I just want to see if I'm getting it.
Yes.
The question he's asking, the follow-up is, all right, you're not going to give them any money, but how do you make sure they eat that month, right? You don't make sure they eat that month. That's not your job to make sure they eat that month. Is that right or wrong?
Yeah, because that is some of the own consequences that they've caused. And so you can help give them ideas. You can say, well, maybe you can pick up an extra shift because obviously you run out of money, so maybe you need to work double time. I have a friend who is looking for somebody to help him with a catering job this weekend. You want to go do that? And, you know, that's sort of what you have to do because that's a realistic consequence, right? Because you can't get into this weird parenting thing where you're like, okay, well, why don't you clean the house? I'll give you an extra $50.
Yeah.
You have to make them sort of go externally to the real world and solve that problem. And if it means food stamps, I guess it means food stamps. Or I guess they're gonna have to get real creative about what's around the house. I guess now you're gonna eat that sort of, old cereal that's maybe expired.
And
by
they
a
have
week.
food at rehab.
They do have food at rehab.
You got it?
Yeah.
All right, Dr. Judy Ho has been so amazing. I know that you have touched so many people in a meaningful way. You do this all the time, so I know you're used to it. But truly, this series has helped so many people understand what they're going through and understand what they can do. So very, very excellent. I'm sure we'll be seeing more from you very soon. Remember, one of the best things that you can do is share MedCircle.com with your friends and family so that they can start their mental health education and start making the next best right decision. I'm Kyle Kittleson, and remember, whatever you're going through, you got this.